And welcome back. I'm Mabel Jong. This is WHCC TV. Thanks for joining us. In our studio this morning, Jeff Kessler, who's president and director of Allergychoices, Inc. Nice to see you, Jeff.
Great to be here, Mabel.
Great
Thank
to have
you.
a check-in again.
Yeah,
it's great to see you. Now, allergic diseases, are we seeing more companies becoming aware that they need to be more cognizant of what employees need in this area?
Yes, Mabel. I think the understanding is growing. Some of it is, the exposure that we've been able to garner from groups like this, and also to come to programs like this. Employers are really looking at their data much deeper than they had in the past, and when they begin to look at things like not just the allergic disease itself, but comorbidities such as asthma, sinusitis, eczema, food anaphylaxis, things like that, it becomes a significant spend for them and impact on productivity for their organization. So there is a general understanding, better understanding than there has been, and of course we hope that we're spreading that word and helping attendees at a conference like this understand that even better.
Any data you can provide on how many Americans suffer from some type of allergy?
The numbers can vary a little bit. Typically they talk about 60 million Americans, so we're talking 20% of the population, 1 out of 5 folks. And when you start to add all the comorbidities together again, sometimes I think that number can be underestimated, if you will. So it's prevalent. It's probably one of the most prevalent diseases in the United States, and it's one that really is wholly unaddressed too, other than through medication use.
Okay, and primarily what kind of allergies are we talking about?
So the primary ones are inhalant allergies, environmental allergies. Those would be pollens, molds, pet danders, the typical thing, house dust mites. Those are really the biggies, and that's would be probably the majority of allergy sufferers. But we're seeing food allergies, grow more than they have in the past, particularly with children. So those numbers are coming up as well. That's more in that 4 to 6% area. So not as prevalent, but growing. And we always see a linkage between environmental allergies and food allergies.
Okay. And when we're talking about employees, we need to take into account families, their families,
Absolutely.
Children who are at home, stay home from school with an allergic reaction to something.
Absolutely.
Is that right?
Absolutely. We talk in terms of covered lives when we're talking to an employer, because it does include not just the employee, but their families as well, many times. And even if they aren't covered by the insurance there, you're right, they're dealing with, let's just say it's a child that has significant allergies, or the employee themselves, they're going to have a higher number of respiratory infections, sinus infections, things that are going to potentially take them out of school or work for a day or two. And yeah, you're right, they're scrambling to figure out how to cover for that, and there's an expense involved in that, and those are all the things around productivity that we're beginning to, I think, help the employers understand too. This is kind of a little insidious disease that doesn't get the same kind of attention that cardiac issues do, and diabetes. Those, of course, need attention, but this one kind of flies under the radar, and it's not as readily understood.
Right.
So you're right, it does impact being absent, and then there's always the presenteeism piece of it too, where people that, if you're having allergies and you're taking medications, you may not be sleeping well. There could be a lot of other things that are going on that take away from you being 100% at what you're doing, and so it's not just the absenteeism, but the presenteeism as well.
So ideally, what does Allergychoices want to see going forward from benefits consultants, employers, to help cover these covered lives?
You bet. So what we are able to provide is a protocol that can get implemented into on-site clinic, near-site clinics, direct primary care providers that an employer might be working with. And the reason for this is that immunotherapy is the only disease-modifying approach to treating allergies. The prevalent treatment approach is medications and avoidance. Just stay away from it. Well, of course, that doesn't work very well for a lot of employees and their families. So immunotherapy, or retraining your immune system, is the methodology that we have a protocol for, and that's what we talk to them about. So it's bringing actual disease modification, change in their long-term trajectory with their disease to them, and doing that by implementing our protocol with their providers. And that is raising the number of people that are able to get access to immunotherapy. It's underutilized therapy in the United States, significantly underutilized. So we make it easy. Our approach is sublingual immunotherapy. So these are allergy drops that are taken under the tongue. Very safe and effective, and they can be taken at home, so they're very convenient. So what we see is adherence rates are higher, and what we're doing is we're retraining the immune system so that the spend and the productivity issues go down as they begin to treat the cause of their allergies. Reduction in medication use, they don't have as many infections. All of those things begin to subside, and that's where the payoff is, if you will, the return on investment of being able to treat somebody for their immunotherapies at the cause, not just the symptoms.
Is it catching on, the immunotherapy?
Oh yes, yeah, it is. We work with large employers. We're working with the benefits consultants. There's a lot of education that's going on. As I mentioned before, Mabel, we don't have, we're not as well known of a disease that has gotten a lot of attention, but we're starting to see some of the data analytics companies look deeper into this. Probably the most telling disease associated with allergies is asthma. So, looking at the utilization for that, looking at the medication spend for that, we're starting to see some pretty astounding numbers in terms of what an employer's having to deal with to do that. And like I said, you can layer on sinusitis, skin conditions, food anaphylaxis, or food allergies and that sort of thing, and it becomes pretty significant. So.
All right, Jeff Kessler. And Jeff, let me ask you, what keeps you coming back to the World Healthcare Congress?
Well, this is our second year, and as a matter of fact, this year our company is exhibiting here. Well, I think it's the quality of folks that we've met here before. We really, we found the folks that think outside of the box. They're really keen on finding ways that we can improve the healthcare system and do it, in a way that's actually, is something that's doable. So not trying to boil the ocean, but trying to find solutions that are, something that you can bring to an employer. And we're finding that here. There's a lot of great thinkers. The sessions are really good, making us all think outside of the box a little bit. And we have a big pull here in healthcare to figure out how are we going to make it more sustainable into the future. And I think it's conferences like this where the thinkers are coming from that we can attack that and actually get something done.
All right. Jeff Kessler, thank you so much for your time today.
My pleasure, Mabel. Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned. We have many more interviews coming up.